2. Introduction. Clinical psychology is the field of psychology which seeks to understand the complexities of human behavior and emotions, and the role of psychological, biological, and social factors in the same. From the modern perspective, it also encompasses the issues like the effect of culture, gender, and ethnicity on modern society, along with focus on the present issues of popular culture, technology, and economics. With the emergence of various schools of thought and their collaboration has led to contemporary clinical psychology, which seeks the best from these models for treatment, assessment, as well as research on the various clinical patients around the world. This chapter explores the definition of clinical abnormal psychology, definition and causes of abnormal behavior in their historical context. Along with it seeks to study abnormality from the point of views of various schools of thought. In the end, it will bring in light the abnormality and mental disorders as defined and classified by various professionals in the field of clinical psychology. 3. Defining clinical psychology. Although the psychology as a separate discipline is about only 100 years old, it is being taught as one of the most popular undergraduate course in many universities around the world. Among the other branches, clinical psychology is the field with highest popularity. So exactly what is clinical psychology? As defined by American Psychological Association, clinical psychology seeks to use the principles of psychology to predict and understand emotional, psychological, behavioral, intellectual, biological, and social aspects of functioning of humans. Clinical psychology is also aimed at the analysis, treatment, and prevention from psychological disabilities or disorders and enhancement of adjustment and effectiveness as defined by Rodnick 1985, page .1929. Hence, clinical psychology uses the already known principles of human behavior to help them to adjust to their daily hassles or modify any abnormal behavior. For example, a clinical psychologist may assess a school child on various educational tests to predict that whether he is gifted, so to provide him with special treatments and educational programs to make sure the highest use of his potentials. Hallucinations, substance abuse, suicidal attempts, depressive symptoms, eating problems, head injuries, etc. are the areas where clinical psychology can be applied effectively. Psychology paper number 15, Clinical Psychology. 4. History of clinical psychology. Stone Age cave dwellers were the first to treat mental disorders at 500,000 years of age. The medicine man or the early shaman treated the disorder by an operation called as trephination, in which a rod was inserted inside the head, as shown in figure .1. During the supernatural tradition, demons or spirits were held responsible for the abnormal behavior along with the other influences like that of sun, moon, or stars. Many Egyptian, Hebrews, Chinese, and Greek writings often had attributed abnormal behavior to a god or demon who had taken possession of a human. Exorcism, see figure 1, was the main type of treatment used in which the evil spirits were forced to leave the body. Fig 1. Earlier methods to treat abnormality, psychological disorders. Source: Uten language equals English. In 460 to 377 BC, Hippocrates proposed that mental disorders are same as the other diseases being having natural causes. They claimed that the reason for mental diseases is the pathology in the brain which can have appropriate treatments. Hippocrates, also referred to as the father of the modern medicine, proposed that there are 4 vital fluids or humors in a person's body, viz. black bile, phlegm, yellow bile, and blood. It is the imbalance among these which leads to the mental disorders. In 130,200 AD, Galen, an influential Greek physician, elaborated on the traditions of Hippocrates. He took a scientific method by differentiating the causes of mental disorders to physical and mental categories. In the Middle Age, Baghdad was the first place where a mental hospital was established, followed by Aleppo and Damascus. Humane treatment was being provided in these hospitals, but still based on superstitions or rituals. However, in the later part of Middle Age, with the humanism movement, the scientific questioning re-emerged. But from the 16th century, special institutions called asylums, place of refuge meant for ills, emerged. These were the storage places for the insane where mentally ill were more or less handled like beasts rather than like humans. Trephination exorcism. Psychology paper number 15, Clinical Psychology. In 1773, the first public mental hospital which was devoted exclusively to the treatment of patients with psychological disorder was established in Williamsburg, Virginia, but the treatment techniques used were no different than that of the asylums. In the late 18th century, Benjamin Rush, the father of American psychiatry, wrote the first American treatise on mental illness which encouraged humane treatment to the mentally ill. Being one of the main physicians for mental problems at Pennsylvania Hospital, he organized a medical course in psychiatry. In the 19th century, custodial care was increased, but many mentally ill patients were given brain surgery called prefrontal lobotomy, ending them to a permanent negative state or death. Then in 1950s a pill was discovered named phenothiazines which were given to patients who were then discharged. Emil Kraepelin, one of the students of Wilhelm Wundt, established a psychology laboratory, which scientifically explored the psychopathology. Later on he gave a classification system for mental disorders. At that time, syphilis of the brain was one of the most successful discovery indicating organic factors behind general paresis. Later Berheim and Lebo developed a theory that hysteria is a kind of self-hypnosis and thus other mental disorders are also due to some psychological reasons. It led to the evolution of Nancy School. Towards the end of 19th century, mental disorders were considered to have both psychological and biological causes. The first American psychological clinic was established in 1896 at the University of Pennsylvania by Pittmer, now known as the father of clinical psychology. Till the 20th century a large number of psychological laboratories and clinics increased along with many scientific journals. 5. Abnormality, chief construct of clinical psychology. Abnormality can be defined as a behavior consisting of emotional, cognitive and behavioral symptoms which may lead to harm. It is a behavior that tends to deviate from societal norms. DSM-IBTR defines abnormality as cognitive, behavioral or emotional dysfunctions which are not expected in the context of their culture and that may lead to a personal distress or significant impairment of functioning. DSM-IV 1994 describes mental disorder as a clinically substantial psychological syndrome which occurs in a person and which may lead to distress and/or deviation from cultural and societal norms. The response must be currently perceived as a manifestation of emotional, behavioral, or psychological dysfunction in the person. A popular criterion to describe abnormality is the criterion of the 4 Ds: deviance, unusual, different, extreme, dangerous to the person or to others, distress, upsetting oneself, dysfunctional, interferes with daily activities. Psychology paper number 15, Clinical Psychology. The acronym HIDES is another criterion used to describe abnormality. H, help-seeking. I, irrationality, dangerousness. D, deviance. E, emotional distress. S, significant impairment. 5.1 Ways to define abnormality. There are various ways to define abnormality, see Figure 2. Some of them are covered below. Figure 2. Ways of defining abnormality. 5.1.1 Cultural relativism. According to Gorenstein and Sarbon, abnormal behavior is one which deviates from the predefined societal norms. Thus, in order to define abnormal behavior of an individual, one has to first look onto the culture or the society the individual is placed in. Since different cultures may describe abnormality in different ways, thus there can be not a universally accepted one, but some actions. Defining abnormality. Statistical view. Maladaptive behavior. Personal satisfaction. Cultural relativism. Psychology paper number 15, Clinical Psychology. Which are dangerous, wild, or seemingly out of control can be regarded as abnormal universally. Wearing minimal or no clothes in one society may be normal as opposed to being defined as abnormal or even bizarre in the another one. 5.1.2 Statistical point. One definition of abnormality is that it is statistically rare. One example of this is normal curve, in which majority of people falls at the middle, with many few at extremes. But a major drawback is that geniuses also fall at the extreme along with the mentally retarded. So can we consider genius persons as abnormal? 5.1.3 Personal satisfaction. Individuals satisfied with their life are normal, while those dissatisfied or distressed are abnormal. But a major limitation of this approach is even some drug addicts or people with antisocial personality or antisocial activities may rate themselves as satisfied. Will you consider them as normal? 5.1.4 Behavior that is maladaptive. Abnormality is maladaptive by nature. If behavior interferes with daily functioning and has self-defeating consequences, the behavior can be termed as maladaptive. Hence, an individual will be manifested to be mentally disordered if his behavior is consistent and an obstacle to the well-being of the person or to the society he is placed in. 5.2 Approaches to abnormality. Great technological and scientific discoveries marked the late 19th century. Such advancements led to the contemporary clinical psychology, which views abnormal behavior from a scientist's point of view. Various perspectives which emerged in 19th and 20th century defined abnormal behavior and psychological disorders from their own point of views. 5.2.1 Biological approach. Brain and genes are the leader. According to the biological view of abnormality, abnormal behaviors are due to the physical illness in a person's body. The reason behind abnormal behaviors, thinking and emotions are biological dysfunctions. Understanding the abnormal behavior thus requires one to explore the possible causes in the patient's brain, neurotransmitters, neurons, and hormones. Hence, their treatments include drugs to cure abnormal biological functioning and the surgery that fix or remove the problem-producing components of the brain. Therefore, possible causes of abnormal behavior are neurotransmitters, chemical messengers of the synapses. Low levels of serotonin has been found to be responsible for anxiety, depression, and obsessive-compulsive disorder. The death of the cells that produce dopamine is responsible for the Parkinson's disease. Psychology paper number 15, Clinical Psychology. Hormones, chemical messengers of the blood. High production of cortisol is responsible for chronic stress, while low level of insulin production is responsible for diabetes mellitus. Structural damage in certain areas of the brain may lead to abnormality. Damage to hippocampus, as seen in patients with Hum or Clive-Wearing, leads to severe loss of memory. The inability to understand speech may be caused by the impairment in the Broca's area of the left temporal lobe. Schizophrenics have been found to have large ventricles in their brains. The inheritance of problematic genes from parents may also attribute to mental disorders. Disorders which may get passed in genes are autism, depression, schizophrenia, and addiction. 5.2.2 Psychodynamic perspective. Abnormality lies within the unconscious. Started by the Sigmund Freud and further enhanced by the Neo-Freudians, psychodynamic perspective focuses on the unconscious psychic forces and sexual impulses that led to an individual's personality. According to this theory, psychological problem, like hysteria, involves unconscious motives and conflicts that can be traced back to childhood. The structure of personality is based on ID, basic drives and instinctual impulses. Ego release impulses in acceptable ways, and superego completely curbs the impulses. The imbalance between the three may lead to abnormal and socially unacceptable behaviors. In Freud's view, psychological disorders like hysteria and phobia are the result of the anxiety produced by some leaking unconscious forces. Overly powerful superego may lead to feelings of guilt and depression, while weak superego may lead to no feeling of guilt even after hurting another intentionally. When ego fails to keep a check on the id, it may result in the state of psychosis, characterized by unusual and bizarre behaviors and thoughts, and even hallucinations. There are constant unconscious conflicts between the id to release its impulses and ego to prevent impulses from coming into consciousness. Ego may resort to self-defense mechanisms in the process. Unresolved conflicts may end the individual to symptoms of psychological disorders like phobias, hysterical symptoms, and behavioral problems. Freud proposed psychosexual stages of development, viz. Oral, anal, phallic, latency, and genital. He claimed that too much or too little gratification of desires at any stage may lead to a fixation to that stage, resulting in problematic personality characteristics. For example, excessive breastfeeding at oral stage may lead to a dependent personality, while early weaning may lead to a dependent personality of the individual. Unresolved Oedipus complex in phallic stage may end the person to avoid men in future. 5.2.3 Behavioristic approach. Abnormality is nothing but a fault in learning. In 19th century, behaviorism was a scientific movement led principally by John B. Watson, an American psychologist, and Ivan Pavlov, the Russian physiologist who focused on the role of learning in explaining normal and abnormal behavior. According to them, abnormal behavior is just a result of the acquisition or learning of a maladaptive or inappropriate behavior. Other behaviorists like B.F. Skinner described behavior as the product of the genes and environmental stimuli. For example, a child with avoidant parents may learn to thrive on inner fantasies and cut off from the realities of the outside world. Psychology paper number 15, Clinical Psychology. Ivan Pavlov discovered that when an unconditioned stimulus food elicits an unconditioned response salivation, and when this unconditioned stimulus is paired with a neutral stimulus bell, then the neutral stimulus bell will get converted into a conditioned stimulus, which will in turn elicit a conditioned response salivation. Just like this, classical conditioning may also contribute to the cause of several phobias or anxiety. For example, a person may develop phobia from riding a bicycle after being into a traumatic experience of accident with the bicycle. Here, bicycle being a neutral stimulus earlier, got paired with an unconditioned stimulus of trauma to become conditioned stimulus and elicit a conditioned response in the form of phobia and anxiety. Skinner proposed operant conditioning, according to which the rate of a particular response is increased by its consequences. We tend to learn behaviors which provide us with positive reinforcers, money, praise, food, and avoid behaviors which may result in disapproval or pains. But when people lack efforts or skills required to obtain positive reinforcements, they may develop abnormality. For example, bad social skills may lead to disapproval from others, which in turn may result in isolation and depression. 5.2.4 Humanistic approach. The power of unconditional positive regard. Abraham Maslow and Carl Rogers were the leader of the humanism who proposed that every human has an inborn striving for self-actualization, i.e. the highest realization of one's potentials. They believe that when this tendency to self-actualize is hindered by environment, it may result in a distorted self-image and thereby abnormality. Parents should provide their children with unconditional positive regard, i.e. providing them with love irrespective of their behavior, in order to help them develop a positive self-image. But if parents fail to provide unconditional positive regard and instead give conditional positive regard to their children, i.e. loving their children only if they behave in certain ways, it will direct the child to disown his own emotions, thoughts, and actions. Researchers have found that people who had received conditional positive regard in their childhood tends to develop more upheavals in their moods and their married relationships. Such children tend to develop conditions of worth, i.e. they will perceive themselves worthwhile only if they behave in certain ways, but in the process they actually deny their true feelings or disown a part of themselves, which will ultimately end in a distorted self-concept. Such distortions prevent people to channel their psychological energy to self-actualization and personal growth, but rather towards continued self-denial and defense mechanisms. Hence the ultimate result is frustration and anxiety, which are prerequisites to abnormality. 5.2.5 Cognitive approach. Cognitions are the key. Cognitive processes like thoughts, beliefs, expectations, and attitudes underlie a person's way of behaving, according to cognitive theorists. Their focus is on the people's expectations, attitudes, etc., which shape their perception of reality, and how inappropriate, biased, and faulty processing of information can give rise to abnormal behavior. Information processing model suggests that human cognition takes place in several steps: input, perception-based manipulation, information interpretation and transformation, storage, in-memory retrieval, access to information stored in the memory, and output, action based on acquired information. Disturbances in these processes may lead to what is called as psychological disorders. For example, schizophrenics frequently jump from topic to topic, reflecting problems in retrieval and manipulation of information. Moreover, Psychology paper number 15, Clinical Psychology. They also have difficulties in attention focusing and filtration, indicating problems in the process of input. Albert Ellis 1977-1993 proposed that troubling events in a person's life themselves are not anxiety-provoking, but it is the irrational beliefs that accompany them. Such inaccurate beliefs often lead to maladjustment and abnormal ways of behaving. Aaron Beck, another significant theorist, proposed that it is the cognitive distortions, or errors in thinking, that lead to depression. Like a person overlooking the positive aspects and judging himself entirely on the basis of his failures will finally end up at the door of depression. 5.2.6 Sociocultural perspective. One's society is to be blamed for abnormality. Psychologists promoting the socio-cultural perspective claim that it is not the person but the failures in his society that leads to abnormality. Thomas Szasz 1961-2000, a psychosocial theorist, has gone to the extent of saying that abnormal is just a tag that society gives to people deviating from its norms, but in actual there is no such thing like psychological disorder. A recent study conducted to explore the relation between rates of mental disorders and ethnic group differences revealed much to be known. Researchers used data from a national representative sample of adult Americans. They found that disadvantaged groups of Hispanic Americans and non-Hispanic Black Americans had lower rates of mental disorders as compared to non-Hispanic white people. However, further focusing on the chronic level of psychological disorders, they found that Hispanic Americans and Black Americans tend to have more persistent mental disorders than the European Americans. The depression was very common among the disadvantaged group, due to loss of their connectivity with the world. Hence, according to the socio-cultural perspective, it is not the individual but the social ills of society like discrimination, poverty, prejudice, social decay, lack of economic opportunity, etc., which leads to abnormal ways of thinking and behaving. 6. Scope of clinical psychology. 6.1 Mental health team. Comprehensive and good evaluation, assessment, diagnosis and treatment of patients' problems involve a number of professionals who may gather information from several sources and help patient via varying perspectives. A patient may require having contact with various mental health professionals and social agencies, which then interact with each other in order to integrate all the available information to finally arrive at a treatment plan. These professionals may include clinical psychologist, counseling psychologist, psychiatrists, psychiatric nurse, psychiatric social worker, etc. 6.1.1 Clinical psychologist. A professionally trained person who on a daily basis deals with the issues of diagnosis and treatments of mental disorders is a clinical psychologist. They may also have the abilities to conduct researches on the diagnosis, assessment and treatment of these disorders along with exploring their causes or origins. Such practitioners are been trained to use the verbal methods of Psychology paper number 15, Clinical psychology. Speech to persuade people to change their ways of feeling, thinking and behaving in order to reduce the levels of their distress and anxiety, a method popularly known as psychotherapy. They may achieve a graduation degree and pursue PhD in clinical psychology. They can be found practicing in hospital, university, mental health care center, clinics, juvenile court, etc. 6.1.2 Counseling psychologist. The work of a counseling psychologist may look similar to a clinical psychologist, but actually they focus less on mental disorders and more on the daily life problems. They may deal with a person's adjustment problems, education, prevention, etc. They can be found practicing in various industries, schools, community health centers, etc. 6.1.3 Psychiatrist. A psychiatrist needs to have a MBBS and MD degrees from a medical school with specialization in the field of psychiatry. They generally adopt a biological point of view to assess the causes of psychological disorders, diagnosis and treatment of the patient. They are ultimately responsible for interview and examination of hospitalized patients, and to decide and supervise the type of treatments to be used. 6.1.4 Psychiatric nurse. Generally functioning as an immediate assistant to the psychiatrist, a psychiatric nurse may also help other members of the staff in developing and executing a plan for the treatment of the patient. Before practicing, they should have a bachelor or master level of training in nursing, but an additional specialization may help them to allow prescribing psychoactive medicines to patients. Observing the changes in the patient status, caring for patient, advising psychiatrists are some of the works of a psychiatric nurse. 6.1.5 Psychiatric social worker. A psychiatric social worker needs to earn a master's degree in social work. He is responsible to explore the social, cultural, familial and other environmental conditions of the patient with the psychological disorder. They may also treat disorders, but with a primary focus on the family and social problems of the individual. 6.2 Activities of a clinical psychologist. There is certainly a long path to be covered to become a clinical psychologist, involving large number of stages viz. Gradation in psychology, master's degree, internship in clinical setting, postdoctoral fellowship, licensure, employment, quest for a higher degree and research work. After being professionally trained, a clinical psychologist need to be involved in a variety of activities ranging from teaching to consultation to research work. Here we will discuss some of the activities of the clinical psychologist. Psychology paper number 15, Clinical psychology. 6.2.1 Assessment. Various psychological tests and measures are employed by the clinical psychologists to assess or diagnose a patient. See figure 3. The assessment is done generally in the light of both psychiatric issues, personality disorders, psychosis, hysteria, etc., and non-psychiatric issues, relationship issues, family history, social environment, etc. A psychological assessment thus may involve all behavioral, observational, cognitive, neuropsychological and personality measures of an individual. Thus, while a physician will focus only on the problematic part in brain leading to a severe memory loss, a clinical psychologist will focus on the contribution of traumatic experiences, family relations, cultural and personality factors in addition to the problem in brain parts. Moreover, a clinical psychologist may not only assess an individual but also a group of people. Hence, a good assessment requires the psychologist to use appropriate amount of tools in the light of socio-cultural, psychological and biological perspectives. Figure 3. A cartoon on the assessment of patient developed by Mark Anderson. Source. 6.2.2 Treatment. Alcohol, drug abuse, hallucinations, depression, phobia, traumatic experience, loss, conflicting relationships, eating problems, mental retardation, anxiety, sexuality, etc. May require an individual to seek psychological treatment. There are various schools of thoughts and treatment approaches that a clinical psychologist may resort to. But they generally use an eclectic method, i.e. integrating various clinical approaches and perspectives in their method of treatment. Some may resort to hypnotism, family analysis or psychoanalytic methods only. Evidence-based treatments are the empirically supported one nowadays used in order to provide a structured treatment plan to the practitioners. Treatment manuals are also common these days. Treatment approaches supported empirically are the one manualized and constructed for many problems like pain control, depression, conduct disorder, anxiety, etc. and are widely supported by APA. For example, for depression and bulimia, interpersonal and cognitive psychotherapy are empirically supported treatments, while for OCD, exposure and response prevention are the empirically supported ones. Psychology paper number 15, Clinical psychology. 6.2.3 Teaching. Full-time professors of universities teach students at the undergraduate, graduate or postgraduate level. Other teachers may include ad hoc lecturers or part-time teachers. Others may teach or supervise interns, trainees at clinical or organizational settings. Thus, psychologists' teachings can be seen in clinical, hospital or business environments. For example, a clinical psychologist may teach employees of an organization to how to manage stress. Others may work in hospital settings to instruct trainees to how to use various tools associated with the psychological treatment. 6.2.4 Consultation. Some clinical psychologists may provide consultation services to businessmen, law holders, school organizers, churches staff, or mental health professionals. Consultation may involve interview, discussion, brief report or a more formal arrangement. Consultation may involve assessment, teaching work, research work or even psychotherapy practices. For example, it may involve assisting a physician to deal with a problematic patient. It may involve assisting manager to solve interpersonal problems of employees. 6.2.5 Administration. Administrative works of psychologists may end them at being a head of a psychology department, dean or president of a college or university. A psychiatric ward of a hospital may offer a position of the unit's chief, or a director of mental health service clinic. These psychologists may also work in clinical settings as directors of training. They may also make firing or hiring decisions in clinical settings. 6.2.6 Research. Research work, see Figure 3, is the core of all the professional activities of clinical psychology. It is the research results which help to determine the most effective treatment technique for psychological disorders. Other may help to determine the at-risk people and methods to prevent psychological disorders. Some researches may aim to find and introduce a more effective approach to diagnosis of patients. Most of the researchers have a part-time job of teaching or at other settings. Findings of the research can be informed via publishing them to journals or presenting them in seminars. However, not all clinical psychologists are involved in the research work, but all of them use the various research results in one way or the other. 7. Summary. Clinical psychology seeks to use the principles of psychology to predict and understand emotional, psychological, behavioral, intellectual, biological and social aspects of functioning of humans. Psychology paper number 15, Clinical Psychology. DSM-IVTR defines abnormality as cognitive, behavioral or emotional dysfunctions which are not expected in the context of their culture and that may lead to a personal distress or significant impairment of functioning. There are various ways to define abnormality: cultural relativism, statistical point, personal satisfaction, behavior that is maladaptive. According to the biological view of abnormality, abnormal behaviors are due to the physical illness in a person's body. The reason behind abnormal behaviors, thinking and emotions are biological dysfunctions. Psychodynamic perspective focuses on the unconscious psychic forces and sexual impulses that led to an individual's personality. According to this theory, psychological problem, like hysteria, involves unconscious motives and conflicts that can be traced back to childhood. According to behavioristic approach, abnormal behavior is just a result of the acquisition or learning of a maladaptive or inappropriate behavior. Humanistic approach proposed that every human has an inborn striving for self-actualization, i.e. the highest realization of one's potentials. When this tendency to self-actualize is hindered by environment, it may result in a distorted self-image and thereby abnormality. Cognitive processes like thoughts, beliefs, expectations, and attitudes underlie a person's way of behaving, according to cognitive approach. Focuses on the people's expectations, attitudes, etc., which shape their perception of reality, and how inappropriate, biased and faulty processing of information can give rise to abnormal behavior. Psychologists promoting the socio-cultural perspective claim that it is not the person but the failures in his society that leads to abnormality. Comprehensive and good evaluation, assessment, diagnosis and treatment of patients' problems involve a number of professionals who may gather information from several sources and help patient via varying perspectives. These professionals may include clinical psychologist, counseling psychologist, psychiatrists, psychiatric nurse, psychiatric social worker, etc. Some of the activities of the clinical psychologist are assessment, treatment, teaching, consultation, administration, and research. 2. Introduction. Clinical psychology is a branch of the field of psychology. There are several specializations that can be branched out of clinical psychology itself. Clinical psychology is one of the specializations in psychology field which makes up the major part of psychology. Clinical psychologists or clinicians are ones who deal with the diagnoses of mental disorders and also treating them. Psychological disorders take a lot of assessment before the correct or appropriate treatment is provided. Thus, clinical psychologists or psychiatrists have a lot of experience in the area of various kinds of therapies and the diagnostic criteria of every disorder. These psychologists are commonly found in working places such as hospitals, private clinics, or health care centers. Clinical psychologists may work in a general field, working with all types of populations and psychological disorders, whereas some may only specialize in treating specific kinds or types of psychological disorders. For example, some clinical psychologists may be working in hospitals in the area of neuropsychology and looking at patients with brain injuries. Whereas some clinical psychologists may work at health centers with people and families who need counseling for patients with substance or drug abuse problems. Some clinical psychologists may also sit in their private clinics and take personal sessions with clients. There are a lot of tasks a clinical psychologist has to deal with. These tasks involve tests being conducted on the patients, including intelligence, personality, aptitude tests, etc., interviewing the patient as well as the family, history taking, performing various types of therapies which may help the patient, and following up with the patient. There are a number of specialties within the clinical psychology. These include health psychology, forensic psychology, counseling, psychotherapy, community neuropsychology. Psychology paper number 15, Clinical Psychology. 3. Specializations in clinical psychology. 3.1 Health psychology. Health psychology is a special term in the field of psychology. This field of psychology deals with the enhancement and betterment of health. It uses several concepts of psychology in order to prevent and treat health issues. It is somewhat similar to community psychology, wherein the improvement of the healthcare systems is taken care of and the creation of awareness within the common population is spread. In the past, philosophers believed that mind and body were the same system rather than seeing them as two separate systems. Thus, it was believed that a diseased person was basically possessed by an evil spirit who had taken over the body. Many rituals were done to get rid of the so-called evil spirit. In the beginning of Renaissance, a whole new shift was seen in the beliefs of the common man. They started to see the use of medicine in treatment of several diseases. Unbar's and Alexander's work in 1950 helped in the shaping of the field of psychosomatic medicine. This was basically given to people suffering from psychosomatic disorders, that is, disorders or bodily problems caused due to the emotional disturbances such as ulcer, colitis, bronchial asthma, and many more. There is thus an importance to have sufficient understanding of the health of oneself and also to understand how to help others to stay healthy. This cannot be possible without the knowledge of psychological and social factors. It is clear that the mind-body relationship concept plays a vital role in the development of the field of health psychology. Health psychologists deal with patients who are on substance or drug abuse. Patients like them are prone to acquire several psychological disorders. Other than that, health psychologists take care of the good health of patients. They organize programs in order to motivate people to stop or quit smoking or drinking or lose weight. The main task of health psychologists is to help people understand that bad health can affect a human being in several ways. For example, eating junk and avoiding outdoor activities is harmful for the body, and that may lead to obesity, which may further affect the social life of the individual, leaving him lonely and depressed. Similarly, taking a lot of stress can lead to smoking and drinking, which may become a habit and later a problem or addiction. Therefore, it is important for a person to understand that it is a two-way street. Psychological factors may lead to health problems, and health problems may lead to psychological problems. There are several ways in which health psychology helps the population or the common man. These include: it helps in assessing and identifying the faulty behavior of the person with the help of various techniques which help the people to avoid illness and bad health. It also helps the people to stay healthy and safe, rather than getting ill and then getting treatment done. Health psychology has been helpful because it has taken several years and experience to come up with reliable and valid measures for the assessment of health-related factors. Psychology paper number 15. Clinical psychology has contributed to the scientific field very useful and solid methods for studying such behaviors. 3.2 Forensic psychology. Forensic psychology deals with the two fields that are psychology and law. Forensic psychologists deal with all the psychological services that need to be provided to the legal community. These psychologists are experienced and trained in the field of assessment, testing, diagnosing, treatment of all types of patients with any psychological problems. The forensic psychologists deal with criminals who may have been provided with insanity plea. Insanity plea is a term that is used by the court when the person who has committed the crime has been diagnosed with a psychological illness. Such criminals are provided with insanity plea, and are kept in a separate environment where they are treated but are not punished in the same way as the other criminals. Forensic psychology is a discipline which has gained significance very lately. Not many people know that in the 44 BC Julius Caesar's death was caused not due to the 23 wounds but the one wound which proved to be fatal for him. If the law and order did not take the help of a physician, it would not have been possible to find out who murdered him. Thus, even in those times, law took help of medicine to solve several cases like this. One of the very first psychologists, William Stern, in 1901 did a study on memory and came up with the idea of eyewitness testimony. This finding marked the beginning of forensic psychology. Many years later, Hugo Munsterberg wrote a book in the year 1908 named On the Witness Stand, talking about all the critics and flaws in William Stern's study. Psychologists in this field are experienced and well-read in the clinical field as well as the law field. For example, a psychologist is providing clinical treatment or playing a role of the clinical psychologist when he or she is trying to help the patient or treat him to deal with the traumatizing effects of the accident. On the other hand, if the psychologist is asked to make a detailed report of the whole accident that took place, then he or she is playing a role of the forensic psychologist and helping the law. There are several tasks a forensic psychologist does. These tasks involve issues of divorced parents to gain custody of the child, claiming insurance. Some psychologists work for civil courts, family courts, criminal courts also. Forensic psychologists also deal with cases which require any type of therapies. This may include sexually harassed children, divorced couples, child abuse, juvenile delinquents, visiting rehabilitation centers and counseling people there, etc. Those working in the civil courts often assess competency, provide second opinions and provide psychotherapy to crime victims. Professionals working in the criminal courts conduct evaluations of mental competency, work with child witnesses and provide assessment of juvenile and adult offenders. In today's time, forensic psychology has gained a lot of popularity and importance in several areas. Thus, American Psychological Association in the year 2001 put forward forensic psychology as a specialization in psychology. 3.3 Counseling. Psychology paper number 15. Clinical psychology. Counseling, as we all know, is a very commonly used term in the field of psychology. It is more or less similar to psychotherapy. Both counseling and psychotherapy are a specialization of clinical psychology. Counseling is conducted or provided to people in need of support to solve their life problems. The people who are unable to cope with their problems or stress seek help from a counselor. The Society of Counseling Psychology describes the field as a psychological specialty that facilitates personal and interpersonal functioning across the lifespan with a focus on emotional, social, vocational, educational, health-related, developmental and organizational concerns. In our day-to-day lives, we have been counseled several times, sometimes by our friends and sometimes by our parents and grandparents. There has not been much history to counseling and psychotherapy, but in the past, when someone was diagnosed with a mental disorder of any kind, he was taken to the priests or the church because it was believed that they were possessed by an evil spirit. At the beginning of the 18th and the 19th century, the Industrial Revolution brought with it many scientific concepts which reduced or lessened the importance of the priest. The common man believed that there may be a much more logical explanation and a more procedural methodology to treat these disorders. Sigmund Freud was one of the pioneers in introducing the hypnosis technique, which was used a lot in the 19th century. Carl Rogers, Albert Ellis, Eric Berne and Abraham Maslow were some other psychologists who had a completely different perspective than Freud, which is behaviorism. There are several types of counselors, including family counselors, child counselors or therapists, etc. The basic task of a counselor is to deal with people and help them to overcome the difficult situation they are presently in. Therapists, on the other hand, deal with patients who are suffering from a psychological disorder or illness. Psychotherapy is another specialization which will be talked about in the next section ahead. The working setting of a counselor can be in schools, clinics, hospitals, NGOs, health care centers, etc. Counselors can be approached with any type of problems. These problems must be of the intensity that they interfere with the individual's daily functioning. A counselor must be aware and well rehearsed with the various types of psychotherapies, including cognitive behavioral, humanistic, existential, behavioral, and psychoanalytic psychotherapy. The various techniques that are used in dealing with the various day-to-day issues are also very important. The counselor must have sufficient experience in the field of clinical psychology so that he is ready and prepared for any kind of patients. The counselor has several qualities which include empathy, unconditional positive regard, listening skills, genuineness, educational qualifications, etc. 3.4 Psychotherapy. Psychotherapy is one of the most important specializations of clinical psychology because it deals with the most major part of what clinical psychology is made of. The psychological disorders of any kind and of any age groups are dealt by the psychotherapists. Psychotherapists commonly and mostly work in the hospital setting. The main tasks of a psychotherapist are to assess the patient, to conduct various tests, diagnose the disorder, and then to treat the patient with whatever type of medication and psychotherapeutic treatment is required. Psychology paper number 15 Clinical Psychology. After the fall of the Roman Empire, the Middle Ages moved back to their beliefs in the supernatural powers causing the mental illness rather than medical causes, and the tortures to remove demonic possessions were restarted. Paracelsus 1493-1541 was the first to advocate psychotherapy for treatment of the insane. There were scattered references about the importance of talking in the treatment of several problems, including emotional problems. At that time, an English psychiatrist named Walter Cooper Dendy was the first one to introduce the term psychotherapia in 1853. There is a major difference between psychotherapy and counseling. The first and the most important difference is that psychotherapy deals with patients with much serious problems than counseling does. The emotional depth in psychotherapy is much more than in counseling. Thus, a person suffering from a mental disorder cannot be taken to a counselor because he is less experienced and does not have the qualification to treat the patient. Another difference between the two is that their theoretical foundations and historical origins differ to a large extent. There are various types of psychotherapies: psychoanalytic therapy, behavioral therapy, cognitive behavioral therapy, humanistic therapy, existential therapy, object relation therapy, family therapy, interpersonal therapy, group therapy. 3.5 Community psychology. It is often thought and believed that most of the time and most of the researches and findings have been conducted in the laboratory setting. But it is the other way around. The psychologists spend most of their time and work in the natural setting. The common man feels more connected to those psychologists who work in a natural setting. Out of all the specializations of clinical psychology, community psychology is the most natural and public and community-oriented specialization. Community psychology is majorly concerned with the relationship between the individual's well-being and the community or the society. The main task of the community psychologists is to check out and keep track of the mental health status of a particular community and how to help them out. Intervention and awareness programs are organized by these psychologists who help the community as a whole. The field of community psychology has gained a lot of significance recently and is still in the process of rapid development. There are several ways in which community psychology differs from the other specializations of psychology. The first point is that the community psychologists make use of the theoretical as well as the practical or applied knowledge of psychological concepts in the environment. Psychology paper number 15 Clinical Psychology. Society around them. The second point is that they not only focus on each individual's mental health, but they focus on the society and the people living in it as a whole. They formulate intervention programs for a group rather than an individual per se. The third point is that the role of a community psychologist is varied. That is, a community psychologist may be working in a court setting one day and in a hospital setting on another day. Community psychologists work in a number of ways. For example, providing special training to parents with children who have behavioral problems or are intellectually weak. Community psychologists also put up campaigns and intervention programs for substance and drug abusers. Community psychologists are unique in their own way because they are clinical psychologists as well as social psychologists. They are completely in touch with the human being and also with the environment they are living in. The main reason why the community psychology arose as a much more identified and trusted field is because the community psychologists reach out to all kinds of communities and all the people who are in need. The main motto of community psychology is that prevention is better than cure. Community psychologists must wear many masks in order to handle the different types of communities. Some more tasks of the community psychologists are: they help in promoting individual growth, also in preventing the society's mental health problems before they occur. Send help or any form of intervention whenever or wherever it is required. Whether the help is required in an urban or in a rural locality. Whether the help is required in a low social economic society or a high socio-economic society. Providing awareness and education to the people who are unaware of the importance of mental health and the how to take care of a person in that case. Community psychology is not one of the professions someone would like to enter right away. But once an individual enters and learns about the various tasks and responsibilities the community psychologists handle, it sure becomes a very interesting and important aspect for the field of psychology and the society also. Community psychology incorporates the responsibilities and work of a clinical psychologist, social psychologist, counselor as well as a psychotherapist. 3.6 Neuropsychology. Neuropsychology is basically the study of the complex functioning of the brain to find out its effects on the behavior of the individual. It studies the relationship between the brain functions and the behavior. Neuropsychology has been a study that has been practiced for several years. In the ancient times, people who were considered to be experienced in these procedures used to perform a surgical procedure named trephination, in which they used to drill or cut some of the bone out of the skull. They believed that by doing so, the extra pressure of the blood causing the stress in the brain will be released, leading to the betterment of the patient. Psychology paper number 15 Clinical Psychology. Over several BCs and later years, many philosophers and experimenters such as Aristotle, Edwin Smith Papyrus, Pythagoras, Descartes and many more, conducted experiments on animals and human beings and came up with a number of theories which were countless and infinite. The mind-body relationship had always been in controversy too. In the 19th century, a doctor named Broca found out with the help of one of his patients and many more, that the left frontal lobe was responsible for an individual's language-speaking skills. After Broca came many more such doctors and researchers who made discoveries that has become an integral part of science in today's time. Neuropsychologists come across patients who have had a brain injury or an accident in which the person has had an internal injury. These psychologists then administer intellectual or personality tests on the patient which helps them to know the current status of the patient. They then interview and talk to the family of the patient in order to find out what the patient's personality and behavior was before the accident. The neuropsychologist will also talk to the school or college authorities and find out whether there has been any change in the patient ever since the accident. The major task is of identifying the severity of injury and its consequences. Thus, the neuropsychologist discusses the case with an experienced doctor also. The neuropsychologist also deals with patients with issues of brain lesions, lateralization, localization, and cerebral lesions. Brain injury is not just a physiological trauma, it can also have several cognitive and behavioral effects. These cognitive and behavioral changes in the individual can lead to psychological and emotional variations altogether. Here are some symptoms associated or linked to the neurological damage and injuries. Impaired memory. There may be some sort of damage to the memory of the patient where he may forget recent information, personal information, or events that may have taken place in the past. Impaired orientation. Inability to remember basic information. For example, forgetting someone's name, or unable to remember the day or month. Impaired judgment. The patient is unable to make important decisions and the problem-solving ability of the patient weakens. Impaired intellectual ability. Special intellectual abilities such as the comprehension, mathematical, logical, general knowledge skills are impaired. Psychology paper number 15. Clinical psychology. Lack or loss of emotional resilience. In such a case, the patient may function well in comfortable situations, but the moment the stressful situation comes along, the patient panics and there may be deterioration in all other skills of the patient. Shallow and labile effect. Here the patient cries or laughs very easily. In simple words, the patient is always on the edge of his emotions. 4. Summary. Clinical psychology is one of the specializations in psychology field which makes up the major part of psychology. Clinical psychologists or clinicians are ones who deal with the diagnoses of mental disorders and also treating them. Health psychology is a special term in the field of psychology. This field of psychology deals with the enhancement and betterment of health. It uses several concepts of psychology in order to prevent and treat health issues. Forensic psychology deals with the two fields that are psychology and law. Forensic psychologists deal with all the psychological services that need to be provided to the legal community. Counseling is conducted or provided to people in need of support to solve their life problems. The people who are unable to cope with their problems or stress seek help from a counselor. Psychotherapy is another specialization in which the psychological disorders of any kind and of any age groups are dealt by the psychotherapists. Community psychology is majorly concerned with the relationship between the individual's well-being and the community or the society. Neuropsychology is basically the study of the complex functioning of the brain to find out its effects on the behavior of the individual. It studies the relationship between the brain functions and the behavior. 2. Introduction. In our everyday lives we may experience some type of uneasiness or discomfort in certain situations or in certain places, etc. These feelings can range up to mild discomfort to highly unbearable feelings like panic attacks. This feeling of uneasiness can be experienced by all age groups and it may vary in intensity. For example, in adults it may be common to experience anxiety in situations where they need to meet with a deadline at work. Anxiety can commonly be experienced by children also, such as when they have an exam to write, or in situations with high adjustments like divorce of parents or change of school. Sometimes anxiety can be useful and motivating in our everyday lives. For example, when we are worried about writing a test, that worry or anxiety motivates us to work hard and prepare better for the upcoming challenge. But when this anxiety becomes overly strong and takes over the senses of an individual which forces him to stop using his mental abilities, problem-solving skills, doing his daily tasks, avoiding social settings and disturbing the daily functioning of the individual overall, it becomes pathological. Anxiety is like an alarm system to the human body which is activated when our body experiences danger or an emergency situation. When the person finds himself in such a situation, he feels certain sensations such as sweating, palpitation, increased heartbeat, dizziness, high blood pressure, etc. These sensations are called fight or flight sensations. Anxiety is a complex mix of unpleasant emotions and thought processes that are both more directed to the future and much lesser than fear. Barlow 2002. Anxiety is not only consisting of cognitive, subjective factors but also consists of physiological and behavioral changes or factors. The three components can be seen clearly in an individual suffering from intense feeling of anxiety. Cognitive subjective level. The individual experiences negative mood, worry, a sense of inability to predict the future threats and self-preoccupation. Physiological level consists of bodily changes from within and outside as well such as palpitation, high BP, sweating, dizziness, etc. Psychology paper No. 15, Clinical Psychology. Behavioral level consists of behavioral changes such as the urge to take flight or fight from the situation. Barlow, 1988, 2002. Anxiety is an emotion identified by thoughts filled with tension and worry as well as feelings of restlessness and several bodily or physical changes like increased levels of blood pressure. People diagnosed with anxiety disorders generally have repeatedly occurring intrusive thoughts or concerns. They try to avoid going in certain places or be present in certain situations out of worry. They may also have physical changes or symptoms in the body such as palpitation, sweating, shaking or trembling, dizziness. Encyclopedia of Psychology. Anxiety disorder is considered to be a pathological condition comprising of an excessive sense of apprehension, with physical symptoms such as sweating, palpitations, and feelings of stress. There are several disorders caused due to excessive anxiety experienced by an individual. It can occur in adults as well as children and adolescents. Thus, anxiety is not something that comes or develops with age. There are several environmental as well as internal factors on which the occurrence of these disorders depends on. Figure 2. Physical effects of anxiety disorders. Psychology paper No. 15. Clinical psychology. 3. Types of anxiety disorders in children. Anxiety in children is not easily identifiable, because children have a lot of energy which keeps them moving around and energetic. To the parents, this high level of activity of sometimes irritability might seem very normal, and therefore they might ignore the symptoms that might be leading the child to an anxiety disorder. Thus, it is very important for the parents or the caretaker to identify the type of anxiety that is being experienced by the child. Doing so will help the therapist to treat the child accordingly, and also because the treatment that is chosen depends upon the symptoms or the type of anxiety the child shows. 3.1 Generalized anxiety disorder, GAD. Anxiety is an emotion which has an adaptive property. This property helps the individual to plan and prepare for future threats or sometimes even events. But, for some people, this anxiety and worry becomes a matter of great concern because it takes a chronic, excessive and unreasonable twist for them. These individuals suffer from what may be diagnosed as the generalized anxiety disorder or the free-floating anxiety. Diagnostic guidelines given by ICD-10. The person or patient must show primary symptoms of anxiety most days for at least many weeks at each time, and generally for many months. These symptoms should comprise elements of motor tension, headaches due to tension, restlessness, shaking in complete body, lack of relaxation, B. Autonomic overactivity, lightheadedness, sweating, tachycardia or tachypnea, epigastric discomfort, dizziness, dry mouth, etc., and C. Apprehension, tension about future mishaps, feeling on the edge, lack in inability in concentrating, etc. There are certain ways in which the therapist or the psychologist may diagnose the generalized anxiety disorder in the child. They use very specific observations and some tests that are completely suitable in assessing the level of anxiety in the child or adolescent. In cases where the child is too anxious or too small to talk, the parents are investigated in order to gain completely reliable information. In case of adolescence, it is better to ask him or her because at that age he or she is more aware of his or her bodily changes than anyone else. Some causes of generalized anxiety disorder have been mentioned below. Psychosocial perspective believes that this disorder is a result of the unconscious conflicts between the ego and the id impulses due to the lack of development of the defense mechanisms in the patient or because they have been broken down. It is believed by Freud that the sexual impulses are the aggressive feelings that were suppressed in the past. Psychology paper No. 15. Clinical psychology. With punishment or negative reinforcement come out as free-floating anxiety in the present. Another explanation given by the psychoanalytic psychologists is the repeated occurrence of unpredictable and uncontrollable events. In cases where this happens, the individual is never ready for the defending behavior and is caught by surprise all the time. This leads to an unsettling and unexpected worry all the time about the unpredictable events that might take place. Cognitive biases for threatening information are another causal factor which psychoanalysts came up with. It is believed and has also been proven with the help of studies and researches that an anxious person will perceive any information as negative and threatening as compared to a person who is not at all anxious. Thus, these individuals who are suffering with anxiety preferentially allocate their attention to situations that are threatening, worsening their condition and never coming out of this problem. There are some biological causes as well which may lead to the generalized anxiety disorder. Genetic evidence of GAD is mixed. It does seem likely that there is a modest heritability, although smaller than for most other anxiety disorders. Hedma, Prescott, and Kendall, 2001. Another biological cause may also be the functional deficiency of GABA. 3.2 Separation anxiety disorder of childhood. It is commonly seen that preschool children and toddlers show some signs of anxiety at some level. This type of anxiety can be seen at times of mother-child separation or the caretaker and child separation. Separation anxiety disorder should only be confirmed when the fear of separation comprises a high degree of anxiety and especially during the early age of childhood. The word separation in this disorder is one that is different from the regular separation, such as the divorce of parents, death of a parent or the caretaker are associated to serious disturbances in the social functioning of the environment in which the child lives. Children with separation anxiety disorder have higher tendency to worry about separation than children who do not suffer from this disorder. Even the slightest of separation can overwhelm the child in such cases, such as going away to attend school, sleeping, when the parent has to leave the child at home when he or she has some outside work to do. The child may experience extreme fear related to the death or major illness of a parent due to the fear of losing one of them. If the child wants to let the feeling of anxiety go away, then he tries to cling on to the parent the whole time, not go out and play with other children and sometimes also making excuses of stomachaches or headaches to stay with the parent. It is commonly seen that the child can stay away from one parent much easily than the other one. This disorder is difficult to diagnose because children who have this type of anxiety may have other types of anxiety disorders other than this one alone. Such children have many bodily complaints like mentioned above, including stomachaches or headaches, which leads to the parent getting more worried about them and subsequently spending more time with the child. It is important that a specialist in this field such as a psychologist for children handles such cases by collecting appropriate information about the child and then leading to a conclusion. Psychology paper No. 15. Clinical psychology. Some of the symptoms identified by ICD-10 are an imaginary and constantly occurring thought of tension about something wrong or harmful happening to the closest person of the child. An imaginary, constantly occurring worry that unexpected and scary event might take place that might separate the child from his loved ones. Persistent, repeatedly occurring or a constant fuss about not sleeping unless the loved one or the attachment figure is around the child. Constant and inappropriate worry of being left out alone at home or outside at any time of the day. Recurrent disturbing dreams about separation. Constant occurrence of bodily symptoms, nausea, stomachache, headache, vomiting, etc. in situations that involve separation from a major attachment figure such as leaving home to go to school. Overly and repeatedly occurring stress in anticipation of, during, or immediately following separation from a much loved one. Some causes of separation anxiety disorder are. This type of anxiety often occurs after there has been a very sad and disturbing event in the life of the child. These events may include the loss of a loved one, loss of a pet, migration from one place to another, joining of school, etc. Another cause may be that some children have overprotective parents due to which they develop such a disorder. Also, there is a possibility that there may not be a true cause of the child's anxiety but just a pass on from the parent itself. The fact that the anxiety of the parent can move on to the child shows that this disorder can be inherited. 3.3 Phobic anxiety disorder of childhood. Phobias in adults is defined as an individual who suffers from a strong and persistent fear that is unreasonable and excessive and is enhanced or triggered when the individual is in the presence of a specific stimulus or situation. Phobias may become so intense sometimes that they may resemble panic attacks, but the only difference between the two is that phobias have a specific stimulus or are triggered in specific situations, whereas, on the other hand, panic attacks are experienced without any specific stimulus. In children, phobias may not be the correct term, but phobic anxiety can be used in their case. Children, like adults, can also develop a fear for specific objects or situations and are also identified as phobias. But some fear of specific objects, agoraphobia, may only be during a developmental phase and they might subside over the years, thus called phobic anxiety. During childhood, the most common fear is of animals, especially during the preschool years. When the child comes across a situation which he fears, he tends to start crying, becomes clingy, freezes their figure 5, or may also throw tantrums. This disorder has a very short lifespan if treated and taken care of in time. But if this disorder is not taken care of, and is enhanced due to certain psychology paper No. 15, clinical psychology. Environmental difficulties, then it may develop into a social or specific phobia in the growing years of the child till adulthood. Some commonly seen childhood phobias include the fear of planes, injections or sharp objects, dogs, bugs, spiders, lizards, etc. Symptoms of phobic anxiety disorder in childhood as mentioned by ICD-10 are mentioned below. The beginning of phobias happens during the developmental years of the child. Level of anxiety needs to be at such a level that it is clinically abnormal, and the anxiety does not form part of a more generalized disorder. 3.4 Social anxiety disorder of childhood. Other than specific type of phobic anxiety, the child may also experience social phobic anxiety, which may occur in situations which are overcrowded, and the child might feel distressed on seeing so many new faces, and also situations where the child is required to make a public appearance or public performance. This phenomenon is normally seen in second 6 months of the child's life, as he moves out of his or her home environment into the outer world and experiences new and strange situations. Thus, this classification must be applicable for disorders that are diagnosed for children below the age of 6 years. During these years, the child starts going to school and makes new friends, performs on stage, confronts teachers, meets new people in school, etc. For some children, this may be a wonderfully new and amazing experience, but children who are afraid of such situations may experience social anxiety. Some symptoms of social anxiety disorder given by ICD-10 are stated below. Children suffering from this disorder are seen with a repeatedly occurring fear of completely strange people. The fear is associated with a normal degree of selective attachment to parents or to other familiar person. The avoidance or fear of social is of a degree that is outside the normal limits for the child's age and is associated with clinically significant problems in social functioning. Social anxiety disorder may be caused due to some of these factors. Genes play an important role in explaining the biological cause of this disorder. That is, if the child's parents or any relative, close or far, has a similar condition, then there is a possibility of the child acquiring that condition too. It is also believed that certain individuals develop this disorder because they have seen anxious behavior around them all their life and learn from them. There is also a possibility that this disorder is a result of overprotective parenting style. The life experiences of the child may also cause the child to acquire this disorder. For example, if the child has been humiliated at some point of time by his friends or teachers, he may have been bullied, sexually abused by an elder person, family conflicts, divorce or separation of the child's parents, etc. Psychology paper No. 15, clinical psychology. Children who are withdrawn, restrained, shy or timid when confronted with a new situation are thought to be more prone to developing social anxiety disorder. 4. Treatment. 4.1 Relaxation techniques. When an individual is suffering from anxiety, a lot of bodily changes take place, including dry mouth, increased breathing, palpitation, sweating, fastening of heartbeat, and sometimes high blood pressure. Whereas, in relaxation mode, the individual is in a completely opposite state where he or she breathes slowly, body temperature is cool, heartbeat is normal and stable, body muscles are relaxed, etc. Thus, if anxiety needs to be decreased, it is very important for the person to be relaxed. Thus, relaxation is an anxiety-relieving tactic. Relaxation techniques have been found to be most effective in the betterment of generalized anxiety disorder. Some commonly used relaxation techniques have been mentioned below. Progressive muscle relaxation. This type of relaxation is specifically for the muscle relaxation, wherein the individual suffering from any anxiety disorder systematically tenses and then relaxes each and every part in the body. This exercise should be done in one direction, that is, from head to toe or from toe to head. And as your body relaxes muscle by muscle, the mind will follow automatically. Deep breathing in an anxious person becomes intense and faster when he faces a difficult situation or object, which causes bodily changes such as dizziness, breathlessness, lightheadedness, dry mouth, and much more. Therefore, the aim of this technique is to stabilize the individual's breathing pattern in anxiety-provoking situations. Meditation is a type of relaxation technique which has been found to be extremely effective not only for anxiety disorders but also for other disorders. The most effective type of meditation has been proved to be effective is the mindfulness meditation. If meditation is performed on a regular basis, then it is believed to boost energy levels and activity on the left side of the prefrontal cortex, which is considered to be the area of the brain responsible for feelings of serenity and joy. 4.2 Cognitive Behavioral Therapy. Cognitive behavioral therapy, CBT, is a type of therapy which has been found to be very helpful in treating anxiety-based disorders. Task of cognitive behavioral therapy is to help us find out the distortions in the way we look at the world around us and ourselves and correct them into healthy ways. In this type of therapy, the child is taught to identify the negative feelings and thoughts and then taught to replace these negative thoughts with positive ones. The child here is also taught how to distinguish between the unreal and the real thoughts. The child will receive homework to practice what is learned in therapy. These are some techniques that the child can use immediately and for years to come. The psychologist or the therapist and the parents of the child take care whether the child is improving. Psychology paper No. 0.15, Clinical Psychology. Or not in the home as well as the school setting. CBT is generally short-term and sessions last about 12 weeks, but the benefits are long-term. Cognitive behavioral therapy consists of 4 steps. Education. Child who comes to the therapist might not even know what he is there for. Thus, the child's parents need to understand very clearly the meaning of anxiety and what type of anxiety it is. Only when they have complete information about their child will they be able to cooperate with the therapist. Monitoring involves the tracking of specific situations in which the child experiences maximum anxiety, how long the anxiety lasts, and what are the physiological and behavioral changes that take place at that time. Cognitive control strategies. With the help of CBT, one learns to think realistically and then change the complete mind process and patterns simultaneously. As the child is made aware of these negative and disturbing thoughts and made to confront them, they will slowly subside and the child will get used to such situations, and also the feeling of anxiety will subside over time. Behavioral strategies. Some effective behavioral techniques are problem-solving skills and time management. 4.3 Medication. There are 3 types of medication prescribed for generalized anxiety disorder specifically. Buspirone. This anti-anxiety drug, known by the brand name Buspar, is generally considered to be the safest drug for generalized anxiety disorder. Unlike the benzodiazepines, buspirone isn't sedating or addictive. Although buspirone will take the edge off, it will not entirely eliminate anxiety. Benzodiazepines. These anti-anxiety drugs act very quickly, usually within 30 minutes to an hour. The rapid relief the benzodiazepines provide is a major benefit, but there are serious drawbacks as well. Physical and psychological dependence are common after more than a few weeks of use. They are generally recommended only for severe, paralyzing episodes of anxiety. Antidepressants. A number of antidepressants are used in the treatment of generalized anxiety disorder. However, the relief antidepressants provide for anxiety is not immediate, and the full effect isn't felt for up to 6 weeks. Some antidepressants can also exacerbate sleep problems and cause nausea. 5. Summary. Anxiety is a complex blend of unpleasant emotions and cognitions that is both more oriented to the future and much more diffuse than fear. Barlow 2002. Anxiety causes a number of physiological, cognitive as well as behavioral changes in an individual. Psychology paper No. 0.15, Clinical Psychology. There are 4 types of anxiety disorders in children, including generalized anxiety disorder, separation anxiety disorder, phobic anxiety disorder of childhood, and social anxiety disorder of childhood. The symptoms have been mentioned after each disorder directly taken down from the ICD-10. Treatment of these disorders in children is quite common, including relaxation techniques, cognitive behavioral therapy, and medication.